Chapter 3. Benzodiazepines, Valium, Xanax, Rohypnol, and more. A few key facts. What is it? A synthesized powder or pill, many different individual varieties. A depressant, a minor tranquilizer to be more precise. Valium and Xanax are widely prescribed in the UK and the USA for sleeping problems. Consumed by swallowing. The timescale varies dependent on the type. Some effects are sedation of mind and muscle, impaired coordination, and impaired ability to concentrate. The term benzodiazepine refers to a group of synthetic substances that have been used since the 1960s as a treatment for panic and anxiety. The first popular benzo was called Librium, but others that you may have heard of include diazepam, often known by the brand name Valium, alprazolam, Xanax, and Rohypnol. There are numerous others as well, most of whose names end with lam or pam. Benzodiazepines may be appealing because they are relatively easy to get compared to some other illicit drugs. It's possible to get prescriptions for some benzos in various countries around the world, although in many places such prescriptions are limited to the short term, often no longer than 4 weeks at any time. Benzos might also be popular because they are a medication, so therefore could be perceived as safe compared to illicit substances made in bathtubs or DIY labs, although how true that is will be explored later. What are the short-term effects? Benzodiazepines are usually prescribed in a powder tablet or occasionally a gel capsule form. If the substances are purchased from other sources, they can sometimes be found as a powder. As such, they are usually swallowed, but sometimes snorted. Some people will use gel capsules to create a liquid and inject benzos, but this is an extremely dangerous method of consumption. Although all benzos have a broadly similar effect, each compound has a slightly different profile. For example, Xanax has a faster onset and a shorter intoxication period than Valium. Benzos are known as minor tranquilizers in the medical profession. This means a medicine to reduce symptoms of anxiety, one that has a minor sedative effect rather than a major effect, such as that required for the treatment of more severe mental health conditions like schizophrenia. They work by inducing sedation to mind and muscle. Some people describe experiencing a cozy sleepiness or a calm chattiness on low doses. As expected, they can reduce feelings of anxiety as well as feelings of tension and stress. Their physical sedation effect means that they can also lower coordination abilities and impact on alertness and ability to concentrate. It's a very bad idea to drive or operate other heavy machinery when under the influence of benzodiazepines. At higher doses, people can start slurring their speech and experiencing more profound confusion. People are at increased risks of accidents because of the impact on coordination and concentration. The sedative effect could even lead to a loss of consciousness or experiences of amnesia or blackouts, similar to those experienced at a high level of alcohol consumption. Also similar to alcohol intoxication are the perhaps paradoxical reports of increased proneness to violence or aggressive behaviour from people intoxicated on benzos. While little is understood about why benzo intoxication might induce such behaviours, one theory is that benzodiazepines reduce inhibition, thus making a person more impulsive and likely to lash out, where they would otherwise resist the urge to do so. If a person takes too high a dose and loses consciousness, they are at risk of choking on or inhaling their vomit. There is also a danger from the slowing and shallowing of breathing that benzodiazepines can produce, particularly in children or individuals with pre-existing lung or breathing problems. What are the longer-term effects? If a person has been using benzos for a while, they will build up a tolerance to them and require a larger dose to achieve the same effect. This is why, in the UK at least, prescriptions to benzodiazepines are broadly limited to 2 to 4 weeks at a time, rather than longer term. There's a risk of both a physical and psychological dependence to benzodiazepines after longer term and heavy use. People who have used benzos in this way report a severe impact on their daily life from being mildly sedated at all times. Similarly, regular users report that anxiety levels can increase after a while of regular use, as well as feelings of panic and sleep problems. People also report decreased energy levels. There have been anecdotal reports of an increased risk of dementia or memory problems in long-term users of benzos. However, there's been little research into this, and at present it is unclear whether these effects could reverse after a person stops taking the substance. A person who has been regularly taking benzos can experience physical and psychological withdrawal when they stop taking them. Medical professionals advise seeking support if you want to quit benzos. Ideally, you will need to taper your dose down over a period of several months, or possibly up to a year, depending on the level of use. GPs that I spoke to also suggested that psychological support, such as cognitive behavioural therapy, can be helpful, as individuals initially prescribed the substance for treating their anxiety may find that symptoms increase when they stop taking them. Withdrawal symptoms also include an increased heart rate and blood pressure, the shakes, insomnia, and sensitivity to light and sound. If a person tries to stop using benzodiazepines suddenly, they are at risk of more severe symptoms, such as seizures, which is why getting support is so strongly advised. Myths and misconceptions. Benzos make highs from other drugs better. Benzodiazepines, when used recreationally rather than as prescribed, are very commonly used in conjunction with other drugs rather than by themselves, although this is not always the case. For example, survey data suggests that 30 to 50% of individuals with alcohol dependence also use benzos. People report that benzos can enhance the intoxication experience of other depressants such as alcohol or heroin. They can also reduce withdrawal effects from these substances. Indeed, benzodiazepines can sometimes be prescribed to help people going through alcohol withdrawal. Other people report using benzos to counter the effects of a stimulant that they have consumed. However, this sort of mixing can be really dangerous. Taking two depressants together, such as benzos and alcohol or heroin, can increase the risk of an overdose, of blacking out, and therefore the risk of choking and of suffering ill effects from breathing being slowed. Conversely, mixing benzos with stimulants can mask the effects of both, meaning higher doses of both could be taken, putting extra strain on the heart and the liver and increasing the risk of overdose and of tolerance building up. There is also an increased likelihood of larger withdrawal effects, some of which could be potentially dangerous, as described earlier. So this is a myth. Valerian tea is natural Valium. Valerian is a herb that grows in Europe and Asia. The root has been used medicinally since ancient Greek and Roman times, and it's still marketed today as a herbal medicine to treat conditions such as insomnia, anxiety, and restless leg syndrome. However, there's no known active ingredient in valerian root, and certainly not a benzodiazepine-like compound, although there's some inconclusive evidence that valerian root has an impact on a neurotransmitter called GABA, also implicated in the effects that benzos have. But is there any evidence to support valerian tea having an effect on insomnia or anxiety? To date, there has been very little good quality research conducted, and the evidence is pretty weak. A systematic review of the literature on the link between valerian root and anxiety found only one study that had investigated this to a high standard, with only 36 participants. This study found no evidence that the effect of valerian was any different to a placebo, and weak evidence that diazepam, also tested, reduced anxiety symptoms to a greater degree than valerian root did. Similarly, a review investigating herbal medicine and insomnia found no evidence that valerian root is effective to treat this either, so it's a myth. Grapefruit juice can increase the high. There's some evidence that grapefruit juice interacts with a number of different medications. And included on that list are certain benzodiazepines, including diazepam, midazolam, and triazolam. Grapefruit juice can result in slower metabolism of these substances, leading to a build-up of them in the blood. But rather than increasing the high, this is more likely to increase the risk of unwanted side effects such as passing out or loss of coordination. Other medications can also interact with benzodiazepines in this way, including antihistamines and some other medications that treat depression. So this is partly true. Do benzos have medical uses? Benzodiazepines were initially discovered in the mid-1950s and were investigated as a potential medication to treat anxiety after animal studies found that Librium, the first to be synthesized, made mice relaxed and drowsy. At the time, barbiturates were used to treat anxiety, but these had a high risk of negatively impacting on a person's ability to breathe properly. Librium, and then a few years later Valium, immediately became extremely popular, particularly in the USA. By the 1970s, they were topping most prescribed medication lists, but by the 1980s, it was becoming more obvious that there were risks of dependence from long-term prescriptions. While these risks are still very real, benzodiazepines are still prescribed across the world today, most commonly as a short-term treatment for conditions such as panic disorder, generalized anxiety disorder, or insomnia. Benzodiazepines can also be used in conditions where people have seizures, as the sedation effect of the compound can quell these. For example, people with epilepsy who have prolonged seizures, and people experiencing alcohol withdrawal, where it can ease agitation and trembles that can occur. Benzos are sometimes prescribed for pre-surgery anxiety, and can also be used in a medical setting to reduce panic in individuals having a bad reaction to intoxication on a hallucinogen. What don't we know? There's some evidence that there might be a risk to the fetus if benzos are used during pregnancy. There is a small increase in the risk of the baby being born with a cleft palate, although the overall risk is low, and the evidence to date suggesting a causal link is not strong. Most of this research has been conducted on individuals who were prescribed benzodiazepines during pregnancy, and who were likely to be experiencing conditions such as anxiety or epilepsy, which could also increase the risk of complications during pregnancy. Similarly, many of the women in these studies were taking other medication as well, so pinpointing the effect of benzodiazepines specifically is challenging. There are anecdotal reports of babies being born with what is referred to as floppy infant syndrome if benzos are used very close to birth. Symptoms of this can include poor muscle tone in the infant, sedation, impaired metabolic responses to experiencing coldness, or reluctance to suckle. These symptoms have been found to last somewhere between a few hours up to some months after the baby was born. However, there is little evidence that these symptoms are associated with longer-term problems in the child, and whether the use of benzodiazepines during pregnancy is a significant risk that outweighs the potential benefits they might have is not clear. Outside of benzodiazepine prescription, problematic patterns of benzo use have been found in survey studies to be linked to socioeconomic factors such as being in receipt of government benefits, being homeless, and having previously been incarcerated. This is quite a complicated finding to unpick. Is it that people with these backgrounds or experiences are more likely to be drawn to using benzodiazepines? Or does regular consumption of a sedating substance like benzos make holding down a job harder or maintaining social networks more of a challenge? In all likelihood, it is a complex relationship operating in both directions, and it's also important to remember that most people using benzodiazepines will also use other substances, particularly alcohol and heroin, and that the use of benzos along with these substances often predicts more problematic and dangerous use and poorer outcomes than using those substances without using benzos as well. The majority of people who use benzones but do not use other substances tend to do so after initially being prescribed them, perhaps highlighting how difficult it is to stop using benzos once you've started. When I was growing up, the benzodiazepine that I had heard of because of many media reports was temazepam. Data collected in 1987 suggested that it was the prescription drug most commonly used illicitly across the UK. It was particularly used among people who injected drugs, according to a study in 1994, and was implicated in a rise in drug-related deaths in the early 1990s in Scotland. Because of these harms, and perhaps the media attention too, temazepam is no longer available on the NHS, and if pharmacies stock it for private prescriptions, they have to follow strict restrictions, for instance storing it in safe custody on their premises. Prescriptions have to go through special controlled drug prescription form. Why was temazepam so problematic during this period? It's possibly because of its profile compared to other benzodiazepines, such as speed of onset and duration of effect. But it may also be more prosaically due to availability. Temazepam was around, so it was used. Also, it was possible to get temazepam as a gel, meaning it could be injected. Since the change in legislation, it is only available as a solid tablet, minimising this possibility. Today, Xanax, the brand name, the substance is alprazolam, is getting a lot of media attention in the UK. Xanax is a prescription medication, although not available on the NHS, so not, or certainly only very rarely, prescribed in the UK. But illicit Xanax may have been made outside of a pharmaceutical company. If this is the case, then the quality and dosage contained within any one tablet is immediately less easy to predict. It's unlikely that people making their own Xanax will be able to make it to the same standard as a pharmaceutical company, even if they wanted to. And that's assuming it really is Xanax in the first place. If a person buys an illicit substance over the internet, there's no guarantee that they will receive what they ordered. Headlines in the UK have claimed that young people are buying fake Xanax over the internet and experiencing severe negative consequences, including overdose and death. There have been cases where the Xanax was actually nothing of the sort, sometimes instead containing opioids or other psychoactive substances. In Wales, there is a postal-based service that will test samples of drugs mailed to it, called Wedinos. In their 2017-2018 annual report, they detailed having received an increase in benzodiazepines being submitted to the service, behind more commonly sent substances like cocaine and MDMA. However, they also found that a large proportion of the benzodiazepine samples submitted to them in reality contained either a different benzo to the one the sender believed was present, or a different substance entirely. Some samples submitted as Xanax were actually caffeine tablets, for example. Taking a substance without knowing what is in it can greatly increase the risk of harm. Focus on come-downs. Why do some people feel rubbish for a day or two after taking a substance? From alcohol to amphetamine, MDMA to ketamine, stimulants and depressants can lead to a come-down or hangover after the intoxication has ended. What symptoms do people experience? Come-downs can be physical and emotional in nature. A pounding head and nausea are common hangover symptoms. People can feel achy and exhausted after taking a substance. Their stomach might be upset, or they might feel ravenously hungry. And that's before we get onto the emotional side of a come-down. People can feel really down, shedding a tear at the most unexpected thing, or feel quite emotionally flat. Symptoms of anxiety are also a feature of some come-downs, and some people feel irritable as well. What causes a come-down? It's surprisingly hard to research the after effects of taking a substance. This is true for regulated drugs like alcohol, and even more so for illicit substances. While you can bring people into a lab and give them a substance and see what happens, it's more challenging to keep them there for a day or two to find out what happens afterwards. Even so, we understand a bit about what causes people to feel ropey following an evening of excess. Headaches are likely to be caused by dehydration. Not only do some drugs impact how the body absorbs water and how a person then expels it afterwards, but they also impact on judgment and might lead a person to be less likely to look after themselves while intoxicated. Exhaustion is a common come-down symptom, and this is very probably because drugs can impact on the amount and quality of sleep that a person has. Stimulants clearly interfere with sleep, but even drugs like alcohol will impact on the quality of sleep you have. Substances will also play a role in the type of things you get up to while intoxicated, and this can affect the come-down. Surprisingly enough, people who are leaping around in a club until 5 a.m. will feel worse the next day than people who spent the evening at home on the sofa. Psychoactive substances also impact neurotransmitters in the brain. MDMA, for example, is thought to increase the levels of serotonin in the brain, and what goes up must come down. There's some suggestion that serotonin levels will fall below their baseline levels in the day or two following MDMA use, before they return to normal. Another potential reason people might feel rough after taking drugs is because the body might react to them, or adulterates they might contain, as something dangerous to it, a poison, and try and get rid of it. This might explain stomach problems, vomiting, and diarrhea. And of course, individual differences between people, in terms of their genetics, their metabolism, their liver function, hormone levels, and all sorts of things, will impact on their ability to bounce back after intoxication. Can a come-down be avoided? A come-down can easily be avoided by not taking a substance the night before. For people who do take a substance, some of the symptoms can be mitigated. Headaches can be minimised by drinking water, or even better, isotonic drinks that replace any electrolytes you might have sweated out. Allowing yourself time to recover will help deal with the exhaustion you might feel. And if you are feeling physical symptoms such as tremors or impaired vision, it's dangerous to consider driving or operating heavy machinery, even if you wanted to.